Hi, I'd like to thank our speakers and I'd like to thank everybody online. My name is Randall Terada and I am the Decent Work Lead for the Ontario Nonprofit Network. And if you're new to the ONN, I welcome you. We are the provincial sort of network for Ontario's 58,000 nonprofits and charities, focused on policy, focused on advocacy and services for Ontario's nonprofit sector. And we're hoping to increase and show that the Ontario nonprofit sector is a key pillar in our economy and society. And if you're already an ONN member, I'd like to welcome you as well. And of course, thank you for your support. Our public policy research and our advocacy work would not be possible without you, so thanks. Now, if you're experiencing any technical difficulties so far in our webinar, I hope you're not, but if you are, such as a visual lag, or if there's a sound dropout as such, we recommend that you close your browser and reopen it. And if that doesn't work, feel free to cite your technical difficulty just in the chat box below. You'll see on your screen, and we will attend to it as best we can. So with that said, we're just going to quickly send out one more poll just to make sure we gather in all the latecomers, and I'll be with you in a minute or two. Thanks. See you soon.
Thank you so much, everyone, for filling out the poll. It's great to see so many people interested in decent work. And now we will continue with our presentation.
Thanks everyone for filling out that poll, and it's awesome. Like I quote Melanie again, that is great to see so many people interested in decent work. Obviously in this time of COVID and with the gains we've made so far, the wind is at our backs. And if you're I guess if you're a cyclist, you know how nice that feels. But of course it doesn't last forever. And so I enjoin you, let's keep the momentum on decent work going. Today, we're thrilled to have our speakers with us. Each of them, I assure you, is going to provide a trenchant and unique perspective as they bring to the table. And with that, our three speakers are Connie Ndlovu, a PSW from the community care sector, Dr. Tamara Daly, health researcher from York University, and Paula Tenalia, Operations Director from Action Against Hunger International. Each speaker will talk for approximately 8 to 10 minutes, and after that, we're going to have an open Q&A discussion. If you have a question, feel free to insert it now in the question box below, or while they're having their presentation, feel free just to slot your question in to the question box below there on your screen. And everyone joining us today will receive an email with the recording and the slide deck within 1 week of this webinar. So that's great news. So before we start, I would like to turn the screen over to Lawrence Terrien, Manager of Government Relations and Advocacy at Imagine Canada, who will be completing our land acknowledgement.
Hello, everyone. Thank you so much to the ONN team for having me represent Imagine Canada today. I recently moved back to Montreal, where myself and 2 of my colleagues live and work. And I'd like to acknowledge that we are located on unceded Indigenous lands. The Kanien'kehá:ka Nation, commonly known as Mohawk, is recognized as the custodians of the lands and waters on which I am today. Montreal is historically known as a gathering place for many First Nations. Today, it is the home of a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples within the Montreal community. Thank you. Randall, back to you.
Okay. Thank you. Thank you, Lawrence, for that. Our first speaker today will be Connie Ndlovu. Connie works as a PSW in the nonprofit sector for the past 15 years. She was also a recent speaker at ONN's nonprofit-driven conference. Connie knows many PSWs in the sector who are juggling more than one job to make ends meet at home. And she cites that there is a critical need, as we all know, for PSWs in the province. And it's important that the sector continue to be receive adequate funding that takes into account supporting decent wages and job security for all employees in the sector. So over to you, Connie. Thanks.
Sorry, Connie, just before you get started, Randall, I'm just going to ask you if you can share your screen with the audience today. Perfect. Thank you so much. We can see your screen. Over to you, Connie.
Good, thank you. Oh, hi, everybody. How are you? My name is Connie, just like Randall has introduced me. I work in the home care sector as a personal support worker. And what I do as a personal support worker each day is to go to people's homes, the old and frail seniors who live in isolation in their homes, So I help them with the activities of daily living, which is bathing, meal preparation, pericare, and help them also with remind them to take their medication. So that's the job that I do, and I get satisfaction doing this job because you're helping someone who can't really do much for themselves. But also, these days, what really gives me more satisfaction is to do this job, having the PPEs, and leaving that client knowing that I'm still safe. I did not contract the COVID-19 that is really become a very big challenge when we're doing our job as personal support workers in the community. But also the other thing that I want to really talk about today is the differences with the PSWs who work in the community like myself and those who work in the long-term care. I think Randall has already talked about these differences. So in home care, it's the differences are huge. The pay, the work schedule. We don't have the guaranteed work schedule. Like what I mean, going from to work every Monday to Friday with 35 hours, but in home care, we only work less than that. Sometimes you can only have 1 hour per day. It's very hard. That's why we juggle many jobs, to try and support ourselves. But also this has become very difficult during the COVID because you can only work at one place. And the reason the measures have been put in place is to really prevent, going to different places, in terms of this virus. So it's been a challenge, to make ends meet that way. And yet people work in long-term care, they have a guaranteed work schedule. It's 35 hours a week. They are working in one place. The wages are better. They've got benefits, but also the working conditions are much better because you're going at a place where all these measures are in place. But if I'm going to someone's home, I really don't know what I'm gonna meet every day. It could be a new client that I'm just told they need help, but when I get there, I find that things are completely different. And especially this time also, with the COVID, because before we go to our client, we have to call them to do the screening to find out if they are okay, they are not coughing, they're not sneezing, or they didn't have any visitors in the home. And sometimes our clients are going to say, okay, everything is okay, and then you work there, you go there, you find things are different. So we just have to use our PPEs, our masks. So it hasn't been easy, but this is not what people encounter in long-term care or in other group settings. So the community care is completely different. And then the other thing that I was supposed to talk about was, how the COVID has impacted my job these days. So I think I've talked about the PPEs. We've finally gotten the PPEs, but it hasn't been very easy to get the masks. So right now, I can be given, maybe 2 masks to use per day in between clients. When I'm finished with that client, I have to, keep my mask in a bag and go to the next client and use it until such a time that I feel that it's really soiled, and then I can use the second one. So we don't just have all the masks, at our disposal. So we have to be very careful that, we're not, misusing them. But also we have the gowns, just in case there's droplets, and, just recently we're given the face shields also to help with us if, there's been any, you're in contact with the droplets. So we have to use these items very carefully because, there's serious shortages, we all know. That might make our work very difficult if I don't have the masks. But also the serious impact with the COVID that we experience, especially myself as a home care worker, is the gap in our schedules. So when I'm talking about the gap in our schedules, I mean like I can have a client from 9 to 10 to help them with personal care, breakfast, and whatever they need for that hour. And then my next client will be from maybe 1 to 2. Okay, so there's that huge gap in between, which means that, what we do under normal circumstances before the pandemic will just, kill time by sitting in the mall, just waiting to go to the next client, buy coffee or use the washroom and all those things. But with the lockdown of our city, it meant that, those spaces were no longer available for us, we couldn't get to the mall and just sit around the benches. You can't just sit there because of the COVID. We couldn't use we didn't even have the public washrooms. You couldn't even sit outside in the park because everything also is turned upside down because of the lockdown. So it really created a big problem. We just had to loiter around, and sometimes the police they will stop and ask, like, what are you doing? You're supposed to be home, and then you need to tell them that you're a PSW, you're waiting to go to a next client. We ended up telling the employer also to give us the IDs, just in case somebody's asking you, what are you doing outside? Then you show them an ID that you're a community worker, you're waiting to go to your next client. So this really became a huge problem, these gaps in our schedules, and really they shouldn't be there. You can't leave your home in the morning just for 1 hour and the next client is 3-4 hours later. And, I can't go back home because then I need to be paying the TTC tokens, to be back and forth. Or maybe in case I might also get, called for another client in between. You never know because our schedules are not guaranteed. So the impact of COVID really, made us just, just to be in the street and not knowing what to do, but also worry about your health. It's either you're going to catch the virus just being outside there and, you've got nowhere to sit, you have nowhere to buy, coffee or even to eat your food. You are eating your food just standing. And I think, I want to remind you that, most of the time this has been winter. So we've been out in those winters just with no shelter because the city is shut down. This has really been very bad. I wish, those gaps are not there in our schedule. You leave your house and go to work 8 hours and you go home. That would have been better. And these are things that happen maybe in long-term care where people, they've got proper shifts. If it's a 4-hour shift, you're at one place. If it's an 8-hour shift, you're at one place. Whatever it is, this doesn't happen in home care. And really, again, it's because of the funding. So I also want to say, as we transition, to the next phase, I really want to see that, home care is really, the right, left, and center topic in all levels of government. Because I think the other thing that really, made us wonder as home care workers, we did not hear more recognition from all levels of government about PSWs working in home care. The work that we do, looking after the old and frail seniors. We didn't hear a lot of recognition from all levels of government. I don't think they even thought about the home care workers. I don't think they even thought about the clients that we see during this pandemic. They talked about PPEs. They were talking more about PPEs in the long-term care or nursing home or hospitals, but there was no really effort to talk about the PSWs like us in home care, and even to provide the masks to the seniors who live alone in their homes. So most of the things we were to do ourselves. Now, when you don't have a mask, you just have to use a cloth because you can't ignore that old person at home by themselves. They need to be changed their diaper. They need to be given water to drink. They need to be given food. They are bedridden. So I'm hoping that you're going to hear more or see more recognition of this sector in all levels of government. More funding, close those gaps between our schedules, recognize what PSWs pay us the money that the other PSWs get in long-term care. We are working 3-4 jobs just to make a living. The wages are very poor. The working conditions are very poor. There's no guarantee. Who works 3 hours a week? Who works from 9 a.m. to 10 a.m. 1 hour, and the next hour is 4 p.m. to 5 p.m., and that's it for the day? So again, when you say people cannot work in multiple locations during this time, you got to consider that we are working in multiple locations just to end up having 35 hours a week from different employers. It's not because we've got so much energy to go to different employers. We do that just to have enough hours and get paid for a weekly job. So all these things have been taken away now because you can't work in multiple locations because of the COVID. But I'm hoping that, we have learned critical lessons during this time for home care workers and the work that we do. We need to be recognized, because when we begin to be recognized as, like long-term care workers, I mean, there's so much, attention given to that area right now. And I agree, things have to be changed there as well, but also things have to be changed for the workers and the people we look after in home care. I think it's only fair. We're not asking for too much, but we've been talking about funding in this sector for a very long time. And that funding is really shown that these gaps, as long as those gaps are going to be there, it's going to be very difficult to do our job. And if you're going to close those spaces for us to contain the virus, which we agree with, we have to flatten the curve, but realize that we need those washrooms in those malls. We need those benches in those malls, because this is where we sit and kill time before we go to our next client. That needs to be stopped. Those gaps need to be closed. There has to be sustainable funding in home care so that people like me wake up in the morning and go to work and get paid and be recognized for this job. So this pandemic, it really opened a lot of our eyes as PSWs, that you know what, this is not just volunteer, because now we choose, if I'm going to volunteer, do I stay home and be safe with my family, or do I go to work and help that senior and be unsafe while I'm waiting to go to the next client? So I'm hoping that this is something that it's not just what you've been talking about, funding and closing the gaps, but just realizing that when there's a pandemic, there's still work that needs to be done for the seniors at home by the PSWs like myself.
Thank you.
I want to see also, good wages. We do the same training at colleges for PSWs, whether you end up working in home care, or you end up working at the hospital, or you end up working at a long-term care. We do feed tubing in the community. We use the Hoyer lifts in the community. We change the catheter bags in the community. We do the delegated acts in the community. So I don't understand why there should be such a difference even in our wages when we work in the community. Why there should be such lack of recognition when we work in the community.
Thank you, Connie.
Thank you.
Thank you, Connie. Opening up a lot of really good debate on not only the differences in the long-term care sector and home care, but invisibilities of PSWs, no doubt, but more so the particular and individual challenges that home care, particularly home care PSWs face. Thank you, Connie, for that. And moving on to Dr. Tamara Daly. Tamara is the director of the York University Center for Aging Research and Education and director of the Partnership for Age-Friendly Communities within the communities. She recently held the research chair in Gender, Work and Health from 2013 to 2018. And her research focuses on international comparative studies of long-term care covering these topics: gender and health equity, social care policy, quality working conditions, aged care across international cities. And her theoretical contributions are in health services research, feminist political economy, labor process theory. Thank you, Tamara, and over to you.
Thank you so much, and thank you, Connie. I wasn't going to start by talking and saying that absolutely we need a conversation that includes home care and long-term care and community support services, and I think that that conversation needs to be national in orientation, and it needs to focus on how to create good working conditions so that we can have good caring conditions. So thank you for saying that and for reminding us about the conditions that you face in home care. I want to say that I've been doing this research in long-term care and in home care for almost 2 decades. And I've worked in teams where we conduct key informant interviews. And at this stage, our research has amassed about 1,500 key informant interviews and thousands of hours of observation on the front lines in long-term care homes, as well as working with home care workers themselves. And our main finding across all of these studies and all of the countries in which we've conducted this work is that poor working conditions put staff and residents and patients at risk. In other words, decent working conditions create the conditions for good relationship-oriented care, full stop. And COVID exposed the fault lines in our system. We have the shame of having the highest proportion of deaths in long-term care and amongst seniors in the developed world. PSWs have been infected, some have died. It makes the conversation about decent work even more relevant today, although I assure you I would have talked with it just as much fire 6 months ago, because this means a lot to me. So the next slide, please. Or actually, sorry, you're on my next slide. So how do we value care work? We need to acknowledge what the components of decent work in long-term care are. If we can go to the previous slide, please. Decent work needs to acknowledge that there are unique skills that are required to provide relationship-oriented care. Yes, it's learned briefly in school, but these skills are really honed on the job, and they involve a lot of different types of knowledge, including tacit knowledge, which is about knowing the individual. And this type of knowledge is often under-recognized. There's a huge psychosocial component to the care, particularly when people are caring for people with dementia. It's also about training in intimate work and being able to do that in a way that preserves the dignity and the respect of the person who's receiving the care and the person providing the care. So it's body work, but it's so much more, as Connie told us. It's about helping with dining. It's about bathing someone with dignity. It's about interpreting and recognizing when individuals who can't speak are in pain. It's about assessing how to sensitively and effectively support personal care, especially when somebody has dementia. It's about engaging families, and generally about bringing joy and comfort to people's lives. It's about also, in a long-term care setting, about a whole range of workers. So the teamwork orientation is incredibly important, thinking through the way in which cleaners and dietary staff and maintenance workers and nurses and managers work as part of a team in order to provide support and care to older people in this country. It also involves the critical component of time. And often what we hear is that this is rushed work. It's work that needs to be done very quickly and so as to get on to the next client. But it's really difficult to provide relationship-oriented care when there is insufficient time allotted for it. In some of the best homes that I've been in around the world, and there are some of them in Ontario as well, one of the components that makes it a good home is that there's a good leadership team. But oftentimes what we find is that leadership is happening, especially in this province, despite the system and not because of it. So the system itself is not supporting leadership and innovation in ways that it needs to and that it should. And I think a lot about one home where they decided that they were going to treat the metrics that are gathered by the province. They decided that they were going to do okay on the metrics, but they were really going to provide the type of relationship-oriented care that made a difference to their residents and their staff. And in this particular home, there was a mechanic who lived there, and he had a lot of agitation. And they got the idea that they would bring an old van into the backyard of the facility. They removed the hood. They put hooks close to the door. The door was always unlocked, and he would go out whenever he felt like it and tinker with this van. And it became such an amazing thing on this dementia unit that they kept it even when this man passed away, because the staff learned how to use it as part of their activity. They would have car washes. It looked like it was a car that was backed into somebody's driveway. So it created a different type of environment. But it happened importantly because it was a staff member's idea. And the leadership in that home understood their local community, and they were willing to take a risk and take a chance, and also really bring a lot of joy and life to the home as a result. So next slide, please. We can't have any of these components without conditions, good working conditions. And some of those working conditions involve staffing levels, and these staffing levels need to be realistic. We need to consider what the minimum standard of staffing level needs to be, and then we need to add on more in order that we expect the unexpected. COVID is certainly the unexpected, and probably far more unexpected than any of us could have guessed. But all it takes is an outbreak of the flu or an outbreak of diarrhea for the unexpected to really challenge the current staffing levels that we have, which are under pressure under normal circumstances. Compensation is also incredibly important. People need a living wage. They need permanent work. There are too many temporary and casual staff that are working across this province, and with interrupted hours, as Connie reminded us. We need work that involves full benefits and access to services like physio and massage and the other sorts of things that help us to fix bodies that are sometimes hurting as a result of the heaviness of the work. We also need to be reminded that in long-term care and home care, these are amongst the sectors with the highest rates of illness and injury of almost any sector in this country. So competing with policing and firefighting and other work that is considered dangerous. So we need to provide these workers with the sorts of benefits that will make sure that they can protect themselves and their bodies. And as a final note, I think that personal protective equipment and the resources that are required to care, including enough incontinence pads, enough pads for beds, that's simply not negotiable. So we need to think about how we set up a system where we protect people when they go to work and we protect the people who are receiving their care. Thank you very much.
Thank you very much, Tamara. Our final speaker today is Paula Tenaglia. Paula has been working together with communities, governments, and civil society in the global humanitarian and development sector for 15 years. She's been working across Central America, East and West Africa for over a decade. She's provided leadership to humanitarian country teams for the delivery of assistance in countries affected by natural disasters and conflict. In addition to Paula's programming, she led Action Against Hunger's establishment of a learning and development team, Learning and Development Center for Humanitarian Professionals in East Africa. And she is currently the Director of Operations at Action Against Hunger Canada. And together with her team and with countries worldwide, works on innovative solutions towards global hunger, with a specific focus on nutrition, gender equality, gender-based violence, and safeguarding. So thank you, Paula. Over to you.
Thank you, and thank you both Connie and Tamara for your insights and experiences. I'm really pleased to be part of this discussion today, and you know, what we're going through as individuals, as a community, as a country, and as a world right now is just truly so challenging on so many levels. And as I'm following our provincial, our local, and our national response to COVID, I'm also working in support of the global effort to tackle COVID-19 and the immediate and secondary impacts of the pandemic. And I've seen the amazing efforts of our frontline workers, of our health system, and all of the people and communities coming together around this. And I also see the struggles and the challenges and the fear around it. And the parallels between what I see here and what happens in our humanitarian work abroad are often very stark. Next slide, please. This is a picture actually taken. Do you have the next slide? Yeah, this is a picture actually taken of one of my team members. And I'm actually going to quote my colleague Connie here by saying, "You don't know what you're going to meet every day." This is actually a photo taken of a team of nurses, nutritionists, and our volunteer community health workers in South Sudan, where we have some of the highest rates of severe acute malnutrition in the world. And this team was out conducting a nutrition survey in an area that's really heavily prone to flooding. It had rained the night before. And for them to get to where they needed to go to identify the children who needed treatment, it was only possible by wading through swamps like this. And they're risking insect bites, snake bites, sunstroke, malaria, waterborne diseases. And again, I'm going to quote Connie, where she said, "You can't ignore that old person at home by themselves." And this is the same for, many of our humanitarian workers. For them, no team, no child was going to go unassessed that day. They knew the implications of them not showing up to their jobs. So frontline workers, whether they are humanitarians somewhere overseas or whether they're just here in our community, their motivations and drive are unparalleled in some of the most difficult situations. Next slide, please. And what comes with, I'm going to go through a couple of things here. Now, these are points from, the humanitarian sector, but if you look at these, I'm sure they're resonating with a lot of you and a lot of your staff and a lot of the not-for-profits working in this country right now. But some of the challenges in our sector is that high volume of needs equaling that high workload, really fast-paced working environment in changing every day. And right now things are changing very quickly. We all take on a lot of stress and potentially trauma inside our work in a humanitarian environment. So this comes from personal life. It also comes from the work, and those two are often very, and as we all know, very intertwined. The physical, social, cultural, and or spiritual dislocation that happens with humanitarian workers is really prevalent. And we see a lot of that right now. People living and working in remote environments, in isolated environments, in lockdown environments, that can have huge impacts on us as people. Physical security in the humanitarian environment is a big challenge. It's a big challenge. It can be the general environment, the political climate. We face a lot of insecurity on the job, whether it's threats or violent, or just the workplace risks. We have workplace risks here. Not even having PPE is a workplace risk. Physical and psychological health and well-being. I'm going to come to that a little bit later on, but I just want to talk a minute about the work we do, our jobs. The job that we have as an employee or as a humanitarian worker, as a frontline worker, the job content, the aspects of our work that's inherent in the work we do, we sign up for that. A lot of us, we know that, we know what we're going into, and that's good. That's part of why a lot of people do their work. It's the calling for a lot of people. The job context, the aspects of the work environment that arise from the structure of our organizations, how we're allocating shifts, the workload, unfair work practices, the type of support that's available inside organizations. These are things that create a lot of stress and challenge already in overstressed environments, but these are things that we as organizations can control and can put measures on to support workers so that they are, I guess you could say, less stressed. Geography and climate in our humanitarian environment definitely is something that increases the type of challenges we have. But poverty, disease, deprivation, being exposed to other suffering, but also our teams, our workers, ourselves are part of communities, and in many cases are affected by these same things. And a last point I want to mention is moral dilemmas. It's something that happens a lot in the humanitarian sector, and I know it's happening a lot here now with our workers, having to often make decisions that have severe implications on other people, having to choose between the lesser of two evils. This can leave lasting scars on individuals. Next slide, please. So basically, what are the implications of all of these? If some of those resonate for you and you see that happening now, I think we just have to come back and remember that without our people, our organizations, our not-for-profits, our services will not exist anymore. We need to have a healthy and happy workforce. This is essential. And there's a ton of evidence and research out there about the physical and psychological health and well-being of humanitarian workers, of frontline responders. And this buildup of stressful experiences can lead to a lot of long-term issues with depression, anxiety, and burnout. And these are the types of things that we as organizations can look at, because burnout, getting to the point where our team members are physically, mentally, and emotionally depleted, is exactly where we don't want to be. We need to make sure that we are doing things, and we can, because organizations can really contribute to burnout. We can contribute to things like work overload, lacking control of work, insufficient rewards for workers. There's existing community and workplace problems that we can address. So how do we get beyond? How do we get beyond this now? How do we lead and work with our teams, and how do we build resilience, which is going to be really important? Next slide, please. Acknowledging the realities of the individuals in our organizations, the realities of what's happening now with them and the teams, that's really important. We are all coming from different places and experiencing things differently, but we're all going through this together. Acknowledging the diversity of ways in which individuals cope. I have found in my experience working across many countries that how people cope to stress and to an onslaught of emergency work, there's a lot of experiences that can come from that, and you can apply that in the types of programs that you address with your teams. Duty of care and well-being. As organizations, we do need to conduct thorough assessment of risks and put in place or adjust our policies and our support and our programs for teams. And this is something in the humanitarian sector we are doing day after day because of such changing environments. One thing I've really counted on in my experience is sensitizing teams and people about the types of stress, the types of burnout, what are the symptoms, what it is, and even to a certain extent from a very clinical point of view, so that people can self-identify this and have the tools and means necessary to take measures to receive treatment and to mitigate against it. And of course, we can always invest in training for teams in those areas that's going to enhance organizational performance. When you have an emergency and when your staff are taking on more work and doing more things, there's a lot of other things that can fall apart. Communication can break down, team conflict, and these are things that can be managed. And identifying specific support programs or activities to meet your teams, particularly psychological support. Stress and the impacts of burnout can be very high. Next slide, please. I did want to mention that there are also a lot of programmatic, for those of you interested in programmatic learning from the humanitarian sector. You know, there have been many other pandemics, disease outbreaks in West Africa. In 2015, we have drawn a lot of programmatic experience about working with communities and different approaches on Ebola. And I would encourage those of you who are interested, it could be a whole webinar in itself, but there are potentially a lot of learnings from those international programs that can be utilized and approaches here as we move forward. But on a last note, I just wanted to note that resilience of humanitarian workers, frontline workers, there's an incredible sense of resiliency in people, and you see that all over, and the human ability to overcome adversity is absolutely phenomenal. And I believe this is going to be the challenge now of our organizations today, is to be able to invest in the resilience of frontline workers. It doesn't just happen like that. It's something that we need to work on, we need to build on, and we need to do it in a very intentional way to keep our workers, our volunteers' health and safety, and to keep our organization strong to be able to serve our communities better. Thank you.
Okay, thank you very much. And so that means we'll get to our next section, which is the questions section. So I'm going to wait, and please fill in the question box right down if you have any questions of our panelists, and I am going to check it now. And I'm going to, how this is going to work, I think what we'll do is throw out a selection of questions, 2 or 3. I see there's one for Paula, and the others are sort of somewhat PSW related. Do we have any more? Okay, so first one, I guess, is what would a career ladder look like for a PSW? Here's a question for Paula. No doubt you have worked in international crisis settings with a crowded population, very poor sanitation, low level of basic health within the community, very poor disease surveillance, poor health services. So from your experience, do you have any concerns or recommendations for how Toronto's handling its homeless population in this COVID crisis? And the last question I'll throw out there, and feel free to all to jump in. Should personal support workers be a regulated profession? Would that go any way to solving the problem in long-term care? I'll throw that over to you now. Who'd like to go first?
I can add something perhaps about care aides and PSWs having a career ladder from the examples of Australia and New Zealand. They do have different certifications that are available to care aides, and in that environment, that also means that with additional certifications for the job, that there are different rates of pay that are available as well, and there are different types of skills and tasks that people aspire towards. And we have found in our research that does create more opportunities for mentorship, for supervision, for the transfer of experience and learning both on the job and in other settings.
Okay. Paula, do you want to tackle that question about?
I can try. I have to say I'm not intimately aware of all of the approaches being taken here in Toronto around how the city is dealing with and managing the health issues with the homeless population. What I can say though, that is there are a lot of things to consider in terms of best practices in how we are working with communities at identifying the needs that they have, how they are involved in proposing solutions themselves that meet their needs. And I think these are the important things, is the approach that is being taken and in drawing from examples around the world at working with different populations that are affected and that have unique needs.
Mm-hmm. Okay. Does anyone want to tackle the regulation question? Because I have another question coming. No? Okay, here's another question. It's a doozy, but pretty straightforward. Does decent work include freedom from unresourced expectations? In other words, working longer than you're paid to do. I'm sure, Connie, you have some experience here. The example given in the question are bank tellers. I, for one, can say a lot of teachers working in private schools face the same problem of working off the clock. And let's talk about decent work and the freedom from that. Connie, would you start us off on that? You're muted, Connie.
Yeah. So decent work will actually, include all the right things, like, working long hours doesn't make it, decent work. You want to go to work and finish your work and go home, be compensated, good working conditions, you are able to rest. Because you also talk about burnout, right? Which is unhealthy. We don't want to get sick because we're doing work under stressful conditions. So decent work, it looks into all those things. We saw this slide about, from Paula. It talks about burnout, but also it talks about resilience. You can bounce back, but for how long is your resilience gonna be, tried? So decent work must actually, we should not get to our breaking points when we're doing work. It should be decent in such a way that we enjoy it. You can only do the best you can when you're doing decent work, because all other factors are taken into consideration. You've got your break time, you've got your time off, you can relax, you can take a decent wage home, you can have leisure time, you can support yourself outside work as well, because, you're decently paid, and you enjoy doing your work, because it's decent. It takes all those, health and safety issues is all about decent work, right? So yeah, if it's not resourced properly, then it cannot be decent work. If we don't have PPEs right now in this COVID, and we're expected to do the best we can. Without PPEs right now, it won't be decent work.
Okay, thanks, Connie. Tamara.
So right now we are conceptualizing this kind of practice as wage theft. So it is stealing wages from workers in ways that make sure that the work is not valued in the way that it should be valued. And because it's often done in ways that expect workers to give endlessly, that's why we're starting to conceptualize that as a form of theft. And oftentimes when it comes to work in home care and long-term care, this is most often women that are doing this work. So there's also this sense that of giving that is expected, that this is just a natural thing that women who care will do. And I think that we have to take a step back here, and we have to acknowledge that it's work, that it needs to be compensated and paid appropriately.
Here's another question. How can we collectively advocate for frontline workers? What sorts of action, where to focus, etc.?
Connie, I think we can collectively advocate by, valuing the work done by frontline workers. I think, this pandemic has actually, made us, to think that way about frontline workers. We are out there at work. We're actually, pulling the threads together. We are bringing that hope in a hopeless society today when everybody's afraid. We're out there, doing what has to be done. So we've come collectively, even those who never maybe, believed in PSWs. Today they know that, they are the thread in our society today to take care of the sick, and even practicing, the safety measures right now. We're doing this with the whole community, with the whole world. So it's times like this that, we can see that, collectively advocacy for frontline workers, it should be taken seriously, and we value the work that is done by frontline, because we can't stay home. We have to be right there on the front, even during these hard times. So it's really, for me, it's the value of the work and recognizing that, frontliners are the economy of the world.
Okay, thank you. Paula, this next one's for you. Is sensitization / awareness education required training? If yes, what type of programming curriculum do you use?
In our organization, it's absolutely mandatory. We have, and it's not just a single set of training. It happens all through the employee life cycle. So from the time that you are recruited, your induction into the organization, and going into the different facets of the type of work. So whether it's about personal resilience, whether it's about psychological first aid, whether it's about personal security management, there's a lot of defined curriculum around this that are actually very openly available for your organizations here to use. You can access them, and I can provide some resources post-webinar.
Okay.
But there's a lot of this type of curriculum out there that's been pre-developed that would be quite relevant, I think, for people to adapt, even for a Canadian context. But yes, a lot of this is mandatory within our organizations.
Oh, great. Last question on decent work. Talking about when you're going into these facilities, and Connie, based on your experience, decent work assessments, how do we assess decent work? How what would that look like? What would some of the categories be, and how would we go about it?
Well, for me, decent work, like, as a home care PSW, will be even closing those gaps in my schedule. You can't work a day, 1 hour here and the next hour, like that's not decent, So that's, things like that need to be, looked into. But also, PPEs, having 2 masks per day, that's, especially today, that's really, very troublesome. Wages, all those kind of things, when, people in long-term care are being paid, $4 more than someone in home care doing the same job, just different locations, that's not decent work. I mean, so those are things that, are a problem, and also, recognition, you're going to recognize and value decent work, but then you need to know how you define it, So I always wonder if, the home care, given the funding, that, we get, from the levels of government, when we get so little funding for home care, do you value that as decent work, or you think, it's just work? But I value it as decent work myself, because I know the people that I look after, they are grateful for the work that I do for them. And I think it's high time the government also realized, what decent work means for PSWs in home care and act appropriately.
Tamara, you wanted to jump in?
Sure. I think we can evaluate the extent to which there are permanent positions, the extent to which people have benefits, whether or not they're getting the hours that they want to work, when they want to work. What's the rate of turnover in a particular place? To what extent is there a lot of attrition? Are some places, are they able to keep their staff? To what extent are people supported by their closest supervisor? To what extent are they able to engage in social care, not just the bare necessities, but are they actually able to do the full extent of their work? Are they able to find that they can develop relationships, bring joy, do the sorts of things that are actually exceedingly meaningful and that bring most people doing this kind of work into the sector to begin with? So are we creating the conditions that make it likely that people who have come to this work because they wanted to will stay doing this work? That's what I consider to be decent work.
Thank you. And I see on the clock on the wall, we've reached our maximum. I would like to thank everyone for those engaging presentations. And we will now, and I believe that we learned a lot in this time of COVID. And if there are any questions still you'd like to ask, we ask you to post your questions in our COVID blog on ONN's Decent Work website, and we'll get to them and we'll post them to our panel again via email and post the answers to your questions on our COVID and Decent Work blog. So we would love to stay connected with you, with each of you today, whether it's connecting over social media or joining future webinars, or even becoming a member of ONN. But we'd like to thank you, and please do stay connected, and see you all soon. Bye-bye.
Thank you.
Thank you. Bye.